Hello, good evening, good day, good morning, wherever you are in the world. Welcome to the Black Belt Academy of Surgical Skills. My name is David O'Regan. I'm a cardiac surgeon in Yorkshire in the United Kingdom, and I'm the director of the Faculty of Surgical Trainers for the Royal College of Surgeons of Edinburgh. I want to say a particular thank you this evening to Azmi, who is the CEO of Virtual Medical Educators. And he is enabling us to share their platform, and I'm delighted. So if you're joining from their platform, welcome. Thank you for joining us. And if you're returning, again, thank you very much for joining us. So I've dressed for this evening, and this is one of my hobbies, Iaido, the art of drawing the sword. And I'm wearing my hakama and holding my katana. And I'm holding it with my thumb over the suba to stop it being drawn out. Flexus pollicis longus being one of the biggest muscles in the forearm, and that stops people drawing the sword and using it against me. But what I like about Iaido and the katana is that they've explained the art of the sword since the 15th century. And my blade, as you see here, is a razor sharp edge, the ha, a curved bit, the boshi, and the sharp bit at the end, called the kasaki. And the design of the sword is for slicing. And the art of drawing the sword is to draw it within a single breath and slice through and kill your opponent within the second breath. In fact, I watched a YouTube video of a katana expert who sliced a bullet, plastic bullet, sent at him. Truly amazing. But there's something more to it, and I'd like to share with you some basic philosophy. This is from the Book of Five Rings, a classic text on the Japanese way of the sword. And there are 8 principles. Think of what is right and true. Practice and cultivate the science. Become acquainted with the arts. Know the principles of the craft. Understand the harm and benefit in everything. Learn to see everything accurately. Become aware of what is not obvious. Be careful even in small matters, and don't do anything useless. To my mind, that sums up surgery. And the first important tool in surgery is, before you take the irreversible step of making an incision with a scalpel, you need to be absolutely sure that is of benefit to the patient, the risks, and confident in outcomes, and skilled with a knife. But I've often wondered, although this text is very prescriptive in how you wield the katana and use the blade in various forms, and describes a rhythm, we don't do that in surgery as such. And the use of the blade is not explained in its entirety, and the pitfalls of using the blade are not pointed out either. Whereas in contrast, if you go to the quintessential book on English etiquette, Debrett's describes how you hold a knife. And I remember as an SHO, starting in Bath, that my boss, Mr. William Walter Frederick Southwood, stipulated that I must hold the knife like a knife and not like a pen. In other words, the handle of the blade is sitting in the palm, the index finger is down the blade and is cradled between the thumb and the middle finger. The other important thing, which is also echoed in the Book of Five Rings. He wouldn't allow me to do a Ramstead procedure until he said I could cut properly at 90 degrees. And one of the skills of an expert sensei with a katana is to be able to slice a piece of bamboo perfectly horizontal, such that there's no cut or regular edge, and it's all on the same plane. Simple, you might think, but not. Now, the other important thing about the katana, you'd think that these blades have to be gripped extremely tightly. On the contrary, a bit like a golf club, which is described as holding a toothpaste with an open cap, this katana needs to be held balanced in the palm of your hand. And it's the technique and the swing that gets the slicing action akin to casting a fishing rod. Now, with that in mind, I thought there are a lot of parallels with the scalpel. And I'm now going to go to the overhead view. So if you feel a little bit queasy or motion sickness, close your eyes for a second as we come over to my overhead platform. There you go. Now, Swan and Morton make these handles, and in 1932 they established a company drawing on the first scalpel patented in 1915 using Gillette razor blades. And Swan and Morton and Father and Weather, who was also into razor blades, established the Swan and Morton Scalpel Factory, and they are one of the most popular blades in the UK. They come in these silver packets, and it is useful and imperative in the Black Belt Academy to know how to mount and dismount the needle, the blade. The important thing is to use a hemostat, place it on the blunt side of the blade, using as much of the blade as possible and get a firm grip. You'll note that the blade is beveled, and that bevel corresponds to the bevel of the scalpel. And on the scalpel holder, there is a groove, and it's into that groove the blade must sit. And this can be tricky if you haven't done it before. And it's a one-handed movement. Always keep the blade pointed into the table. Slide the blade holder over the top into the groove. Slide it on. And it's a one-handed movement, holding the blade steady, pointing into the table. To get it off, simply lift the end off the edge, reapply the hemostat, and then slide it off. Again, one-handed movement, moving the blade, moving the handle, but keeping the blade pointed into the table. And a bit like martial arts, if you do not get this basic skill right, no matter what grade you are in the Black Belt Academy of Surgical Skills, you'll not go any further. So the lightness of touch comes how you hold the blade. And as I explained, that is with the tips of your fingers, the index finger, the side, the middle finger, and the palp of the thumb. And if I grasp the blade with the handle sitting in the palm of my hand, you'll see that I get maximum feeling between my middle finger and thumb and my index finger. Now it's important that the blade is 90 degrees to what we want to cut. Because if it's not 90 degrees, as I'll show you on a sponge, and you bacon slice the blade, and I've colored the sponge here, you can see that you end up with irregular edges. Whereas you cut perpendicularly to the skin using the curved bit of the blade, not the point, and usually just the weight of the arm. You take it through at 90 degrees, you bring it together, you can see a fine line. The important thing is, though, is that your incisions need to be in relation to bony landmarks. And there are two pitfalls to this. Firstly, many people assume that the drapes are parallel to the patient's body habitus, and they would align incisions parallel to the drapes, only to find it way offline. Similarly, in people who are larger and a lot of adipose tissue, the skin will move side to side. They therefore put the drape from head down over to ensure you do not get lateral displacement. And the third important thing, particularly with long incisions, is to keep it straight. And as a cardiac surgeon, people scoff at the fact that I do one incision. But it's not so easy to get 22 centimeters perfectly down the middle. So making an incision is a two-handed process. And you'll see that I'm using the pork belly from last week's stitching when we closed. Good wound healing starts with a good incision. And in the Black Belt Academy, we want to teach you correctness in getting it right. So it's a two-handed process. Your fingers of the left hand support the skin. You ensure your blade is at 90 degrees and is pressed down onto the skin and drawn, keeping your fingers supporting the skin all the way down. Now, for 5 centimeters, you could probably do it. But for 20 centimeters or over 5 centimeters, the tendency is to turn at the hips. And you'll find that the blade not only turns on its side, but starts doing a Yorker, as in bowling, in curves. So therefore, as you're coming down your incision, ensure that your elbow is abducted and you maintain the perfect line. As I've demonstrated here, I have not used the full length of the incision. I've creased the skin and marked it there, but I haven't gone all the way through there. And this is a common thing that happens with surgical incisions, is that as you go deeper and deeper, you are actually making your final incision different and smaller because there's the gap. In essence, what you need to do is undermine the skin and make sure you use the full length of the incision, because the skin will move over that area. And I do remember challenging myself doing open appendectomies in thin people and how small I can get an incision. And I got it down to a 2 centimeter incision to do an appendectomy because I was able to move the skin over the top. But therein is the rub. My previous teachers also told me the smaller the incision, the bigger the mistake. And often as a trainee, when I got into problems, the first thing they did was increase the size of the incision. Because you have to remember that wounds heal from side to side and not end to end. And I do worry as we go through some of these very cosmetic incisions that are very small, and you put a retractor in, and the retractor's in for a prolonged period of time, what you'll find is that the stretching of the skin around the ends will cause an area of pressure necrosis, and the final wound will look ghastly. So do beware, please. Undermine the skin edges and make sure you use the full length of the incision. You need to understand how much pressure you're putting on, and this can only come by holding the scalpel lightly. Your index finger is a bit like a cantilever on a suspension. It helps you feel and gives you the proprioception. And as before, the palp with the Merkel cells and the Meissner corpuscles in abundance in those areas will enable you to feel the tissue because it's all about feel. So no matter how sharp the scalpel is, you should be able to take a scalpel, on any surface and feel the scalpel going through without slicing it underneath. And I'm just doing this live, wondering what the outcome is going to be, but it's good to practice and feel how much pressure you're putting on the scalpel so you don't have to cut the deep tissues. I do remember a situation where a trainee was taking a radial artery for me. The patient was hepatitis C positive, and he insisted on putting double gloves on. He'd never worn double gloves previously. I asked him not to, but he refused to listen. And in the next breath, I heard, there you go, and we haven't cut the orange afterwards underneath. So in the next breath, I heard David, and I looked up, and his incision had gone straight into the radial artery, and he was spraying the theater with hepatitis C infected blood. And that was because he used double gloves for the first time and had lost the feel of the blade and the amount of pressure that is required to dissect. So, dissection, the pork belly offers a wonderful opportunity to practice dissection. And the blade is a perfect tool. Sharp dissection is clean dissection. And Mr. Southwood, as I mentioned, was like Zorro with his blade. This is a 22 blade. It is big, but it is very, very effective for clearing adhesions and dissecting tissue planes. Because you don't want to be a hewer of flesh. You want to caress the tissues. And I'll show you what I mean. The blade in this circumstance is not cutting in to tissue planes like that, because you're very likely to cut neurovascular bundles that appear. The blade in this circumstance, I'm relaxing my grip a little bit, allowing it to fall more laterally, and I'm using the blade a bit like using a brush. And I'm brushing against the tissue that I'm wanting to dissect free. And you can see, simply brushing the tissue with the lightest of touches, you have that beautiful feeling of tissue planes parting and separating with very, very little effort. And even as I cut here, there we have a neurovascular bundle, all right, between the tissue planes. And there's another one, neurovascular bundle between the tissue planes. Now, sharp dissection is also clean dissection. And if you want to reduce the incidence of your wound infections, I would suggest that you minimize the amount of damage you do with electrocautery. I reduced my sternal wound infections to almost zero simply by taking the knife only through the skin down to the sternum and judiciously used a diathermy to pick up the individual tissues, individual vessels and bleeders. I didn't cauterize everything. It didn't look like a takeaway barbecued spare rib. The tissues looked nice and fresh and clean, and not surprisingly, they healed extremely well. And my colleague, Ashok, was relating a story of a surgeon in India when he was training, who worked in this theater in a very hot climate, in extreme heat, and they had to have the windows open to the outside next to a motorway. And this surgeon sweated buckets and had wiped his head on the back of the scrub nurse's gown on a regular basis to stop sweat dripping in the wound. But occasionally it did. However, he never got wound infections, despite the fact that it was open to the air, despite the fact that he sweated and sometimes dripped into the wound. But what this man did was beautiful with his use of a knife, minimized electrocautery, and dissected the planes out without burning them. And there's To me, a hesitancy on trainees today to learn how to use a knife. And I'd commend to you to get a bit of pork belly, or even if you eat chicken, to skin a chicken using a blade without cutting the flesh. Because this is the joy of surgery. And I don't know about you, I certainly get a great deal of pleasure dissecting tissue planes. And there, right in front of you, with a sharp knife, I'm confidently dissecting these tissue planes and have identified with a knife neurovascular bundles in these tissue planes as I develop them. And that is simply by holding the knife very lightly and brushing as if with an artist's brush across the tissues. There are different forms of knives. There is a 15 blade, and there's a 10 blade, and of course the 11 blade. The 15 blade is very good for biopsies and excising little bits of tissue. However, if that were a lesion, then you'd need to actually remove a good ellipse of tissue such that the two edges come together without tension. It is much longer than the lesion there. But the important thing, as you're holding the knife, and in 15 blade, you can hold it like a pen. But it's important again to use the blade and ensure as you're taking it out that all points on this ellipse that your blade is at 90 degrees to the skin and you're not literally, excuse the pun, bacon slicing it. The last blade, and I don't have one with me, is an 11 blade. An 11 blade is good for stabbing, and I use it for cannulating the aorta or putting chest drains in. Again, hold it like a pen, but note that I've got my middle finger on the blade, and I can therefore insinuate the blade into the tissue. This is 11 blade, and my stop is my middle finger. So I'm not pushing it freely and stabbing the tissue like that, which would be dangerous. I'm taking you back to the overhead cam. And I hope that makes sense. Do get a blade, do practice, learn to feel the blade. The feel does not come from brute strength. Even with the katana, holding it with a tight grip will totally ruin the rotation of the sword and ruin the cut of a perfect 90 degrees through the tissue. Now, I hope this has made sense. I'd welcome any comments or feedback from you. Do put them on the website. I'd be grateful if you could recommend this to your friends. Thank you very much indeed for joining me this evening, and thank you very much to virtual medical educators and ASME for allowing me to share the same platform. We hope to continue this in the future. I'll be back next week at the same time, and we'll continue our story of lightness of touch and the use of the forceps, because dissection, a bit like a knife and fork, is a knife and a forceps. And your hands need to work independently and interdependently to enable dissection to progress. Remember, we're teaching people to caress and respect the tissue and not to be, as Lloyd Barclay Moynihan said, hewers of flesh. Thank you very much indeed for joining me this evening. I wish you well. Be safe wherever you are in the world. And remember, you can hone your surgical skills, as I am doing here in the spare bedroom at home in Yorkshire. Good night, good day, good morning, and I hope to see you again next week. Thank you very much indeed.